Right, well, we're going to talk more on the issue of COVID-19, especially in relation to higher education, in particular universities. And the Chief Executive Officer of Higher Health, Professor Ramneek Ahluwalia, is to talk to us about vaccine mandatory at high institutions of learning. A very good afternoon to you, Prof. It's always a pleasure to see you. Thanks for availing yourself as always.
Good afternoon, Flo, and Happy New Year to you and to everyone. Thank you for having me.
Same to you, sir. No doubt the debate on whether vaccines should or shouldn't be mandatory are about to pick up when we start to see, of course, registrations, university registrations. Where does Higher Health stand on this particular matter? And your recommendations, should this not actually be feasible?
So you're right. Flo, the inevitable reality of the world, and from what we've seen from the scientific global data, is that the vaccines are one of the most possible ways of opening our business economy, which also applies to higher education. So the question on regulation on vaccination, we don't use the word mandatory, we use more regulatory systems, and regulation of vaccination becomes a predominant issue. Now, what the global data and scientific world has clearly shown us is that when the virus enters the human body, it starts multiplying, and we call it as a viral load. But when you have a vaccinated body, you pushes the natural immunity to such a level that it neutralizes the virus or the viral load very quickly, which means you transmit less, or you will have less severe infection, which means your admissions to hospital and death is very minimal comparatively, which gives us very clear data and evidence that what we want in South Africa, or what we want in higher education, is that we want most of the population, and in fact, all of the population vaccinated. So the Higher Health stand is still on the grounds of everyone to get vaccinated. Now, the question on regulations is critical at this moment because it is one of the mechanisms should we start seeing that we can't open our economic system. Now, for example, if you look at the data of what we saw from 2020, 2021 in the academic year, in our universities, in our TVET colleges, in our community colleges, I'm talking about the sectoral data of the post-school education, what we have seen is that most of the teaching happened online, which is 70% of the teaching had happened online, and only 30% was through contact learning. Now, when we're talking about skills development, when we're talking about building engineers, doctors from the higher education institutions, from a post-school, where the economy depends, we're talking to parents, students themselves, and we're talking to businesses, the reality is they want actually skills to be developed. I can't see how a doctor can be developed online in the future. So we have to now gradually move to what we call as 70% in contact learning and 30% online. But that is only possible if we can get people vaccinated. So we are living in an inevitable reality that regulatory systems will need to come in. Should we fail? Should we not be able to get the kind of system we need for having vaccinated people be around us so that we can start opening? Remember, higher education is congregate settings, which means they're congregation in residences, in closed spaces where the spread of the infection is far more stronger. So in this application, vaccinated people being together pose less risk to each other than mixing population in that regard. So I think that's where we are at this moment.
Yeah, but Prof, the reality of the matter though is that some learners will no doubt be expressing themselves and their disapproval with mandatory vaccines. I know you said you're calling it a regulation of vaccines, but they will be saying mandatory vaccination. We've seen students, they're not shy at all, in fact, to express themselves or to be vocal when they are unhappy. You've seen that year after year when it comes to issues of fees, for example. What more when it comes to an issue of access to university when they do have have the capabilities or the financial backing to be able to do so. Is there a plan at this point? I mean, assuming that there's been some thinking about that in terms of the fact that, these students aren't just going to say, oh, okay, well, then I guess, those that don't want to be vaccinated aren't going to just, say, okay, well, I won't go to university. Then there is going to be something that, I'm assuming you're preparing yourselves for.
Absolutely. And students have genuine concerns. There's no doubt about it. There's a reality that we have first-year students coming in, which means they have not been given the kind of exposure to vaccination in the institutions of higher learning like we did last year with the existing students.
Yeah.
So there is an absolute reason that we have to continue giving that kind of knowledge, education, advocacy, and trying to engage our population, making them understand. And the first years are just now coming in. So it's a very sensitive, it's a very critical point. But there are other issues like exemptions on religious grounds, exemptions on health grounds, which we have to be mindful. So the aim at this moment, where we are as a sector is, and I'm talking about the entire sector, because we have to also consider vocational colleges, TVET colleges, community colleges, along with private higher education, and not just the universities, and universities also in rural versus the urban, because in urban universities, the vaccination program was far more earlier established to give far more bigger time for the students to be vaccinated versus rural areas where it took time for us to build the systems of vaccination access in the campuses. So keeping the whole sector in mind, the aim will be right now, and what we are is that every student needs to be enrolled into higher education. So access to education needs to be for every student, irrespective whether you're vaccinated or not vaccinated. But the question we are now engaging is, what are the time spans we should be giving in our communication advocacy, access to vaccinations, building more vaccination access for the new first years coming in, for the students from the last years who've not just been vaccinated? How do we work on the exemptions around on religious grounds and medical grounds, so that we carry the population together with us? And only then we come up with some parameters of guidelines as a sector in general, which will talk to what we call it as regulatory vaccination or mandatory vaccination, as you rightfully posed. So at this moment, it's very important to bring the population together.
Yeah.
But there is an absolute need for us to go into more of contact learning and less on online learning. Otherwise, our whole economic system or the economic system or the skill building system will collapse.
I mean, from a legal perspective, and I know we're particularly talking about, medicine at this point, we have to balance out, the different laws and the different rights in this particular case. The universities have a right to say, they have a right of admission as to who can come in, whether you have to be vaccinated for you to be able to access the university, to be able to be on the campus in the first place. But then that also could be trampling on the right to education. Someone could say legally, I am entitled and I have a right to basic education, and in this case, higher education. And I wonder, if this might become, a sticky legal issue. I mean, we're seeing it play out now, in fact, and I'm sure you've seen it with the tennis superstar Novak Djokovic, where it's playing out in tennis. And no doubt it will at some point also play itself out in the education sector. And this is something that, we need to kind of be prepared for, as I was stating in the previous question, that there are a lot of things that we need to kind of be wary of. And I wonder where you stand on that, where Higher Health stands on that.
So you're absolutely right. It's a 360 view of this one word called mandatory vaccination or a regulatory vaccination. And when you're looking at a 360 view, you also have something called the Department of Labor and the constitutional element, which has been given to us.
Yeah.
So we have been reading all the constitutional sections. So one thing is for sure, that our constitution does provide provision. For example, when you're driving on the highway, there's a speed limit called 120, 100, 60, 80. The reason why is because you can impose risk from yourself to the other individual on the road or yourself as a life matter, which means some of the constitutional rights do get overcome due to the condition of the situation. Similarly, when you have a public health crisis, a disease which imposes risks to healthcare workers, to hospital admissions, to deaths of other individuals, knowingly or unknowingly, has rights given in the Constitution as provision which can overcome your constitutional rights. So there is that element that does exist. But the question is not to abuse it. The question is to use it effectively with better communication with the population and bring the population to understand why it is being discussed. So the universities, as per the Higher Education Act, are employers who have to safeguard both the employee that they hire as well as the public, which is the students, in their workspace, which is in their domain. It's very similar to how the CEO of a hospital has to ensure both the hospital doctors and the nurses and the patients that are coming, or the people accompanying the patients inside. It's a workspace, so there are protocols that you follow. So similarly, these are systems that the employer can do. Now, as a vice chancellor or as a management of the institution, you are looking into your business continuity. What we have advised as Higher Health is look at the epidemic in your system, look at the platforms that you have given, your courses that you are doing.
Yeah.
And what we have advising is a phased approach of regulation, which means certain areas, for example, where you need access to laboratories, where you have healthcare faculties of health sciences, or in residences where students are going to be living in congregations together, which means you are in the residence where the cluster outbreaks predominantly happen the most. But we've been seeing, you have to start looking at how do you start posing regulations in a phased approach for them, and as well as then going forward to every population, in keeping in mind the issues of the first years coming in, keeping in mind the what I've explained, exemptions.
Yeah.
And exemptions are very critical because they do exist in the global system.
All right, Prof, always a pleasure to have you on the show. We appreciate your input. Thank you.
Thank you.
All right, that is Professor Ramneek Ahluwalia, who is Chief Executive Officer for Higher Health.